My name is Wendo Sahar, founder and executive director of Dandelion Africa, a grassroots organization based in rural Kenya. I'm proudly sponsored by Population Matters to speak at CPT 58. Now, Dandelion Africa is a female-led grassroots organization that is focused on women's health, economy, and agency. Our work is through integration where we improve health outcomes, economic power, and education outcomes of rural marginalized community. What is interesting about Dandelion is that we are locally led, rooted and deeply embedded in our communities. Our mission is to improve the health and economy of women in rural areas. Now, what are our similarities between you, where you could be at the UN headquarters today, and us in the rural arid regions of Kenya? You'll be surprised at how many similarities we have. One of our similarities is that we want to protect the planet. We want to all ensure that people enjoy health, justice, and prosperity. We are all geared towards SDG targets by 2030. Some of the key things that we have in common is that we want to reduce neonatal mortality rates. And I know that different countries have different targets, but currently we want to reduce it by 12 deaths per 1,000 live births. We want to reduce maternal mortality rates to a target of 70 per 100,000 live births. And most critically, we want to ensure universal access to sexual and reproductive health care services. Now, the global efforts to lower child mortality rates has achieved remarkable success over the past 3 decades. However, these significant improvements are now under threat. The progress made is at risk of stagnation and potential regression due to a combination of escalating challenges. Some of these challenges are fragile health systems, conflicts, crisis, economic instability like what's happening in my country, Kenya today, shrinking donor funding, as we have seen globally with the current crisis, and most importantly, climate change, which are altering burdens of disease, shifting the patterns of infectious diseases, making deadly diseases and pandemics more likely, and worst of all, worsening maternal and child health outcomes. When we look at the global landscape today, an estimated 4.8 million children die before the age of 5, including 2.3 million newborns. That is just in 2023. Over 280,000 women died during and following pregnancy in 2020 during COVID. 257 million women have unmet need for contraceptive. That's crazy. In today's world, that is just unthinkable. If you look at my country, Kenya, the neonatal mortality rate is at 22 deaths per 1,000 live births. That is so high. Maternal mortality rate is at 355 deaths per 100,000 live births. This can be quantified to 5,000 deaths per year. That is staggering. And only 57% of women have access to contraceptives in my country. Now, Dandelion Africa works in the most remote marginalized areas of Kenya. We want to improve the health and economy of women and children. Today, I'm going to talk very briefly about our backpack nurse model, because it is critical that people in rural communities who have no access to healthcare receive it timely and with dignity. Our backpack nurse model, this is nurses on motorbikes, take services to communities that are either 20, 40 to 60 kilometers away from government facilities. We take contraceptives for free, maternal child health, antenatal, postnatal care, including HIV treatment to those that need it the most. Our programs are integrated to give voice, agency, not just to women, but to youth, because we know that the youth are not just the future, they are here. We have had significant impact between 2019 and 2020, with over 250,000 women accessing contraceptives through our health interventions. We have supported over 36,000 deliveries. And because we want to strengthen health systems, 300 healthcare workers have been trained on postpartum hemorrhage management and newborn resuscitation. Now, one of the most critical aspects of climate change is girls' education. Our role is to improve the agency of girls. And through that, there has been a 100% transition rate of our orphan and vulnerable children program, with 67% of them taking up leadership positions. Just by educating girls and bringing in Boys for Change, which is a program that supports boys to be advocates of change, we are seeing a significant improvement in our environment and in our education. Because of all these things, over 100,000 women have started climate smart businesses through saving groups, or what we call VSLAs. Now, despite their minimum contribution to climate crisis, newborns and children bear 88% of the disease burden linked to climate change. Unless these challenges are addressed with clear intention, millions of newborns and young children will continue to die from preventable causes. So, what now? One of the most critical things that we are advocating for is investing in research. From past experiences, there is lack of research into strategies for climate adaptation with a focus on pregnant women and newborns. There is need to further research on women's agency and reproductive rights. This is because it takes agency for a woman to actually seek out an incredible service like reproductive health, so that the data that you are using in these forums can reflect what is actually happening in my village in Risa, in my village in Mogotio. We can address structural inequalities that lead to these increased vulnerabilities. Now, when we invest in research, we provide a platform for the voices of those at risk, for the voices of women in Risa, to contribute to the solutions that best work for them. We are always talking about value for money, especially now with this shrinking donor funding. But there is no value for money without value of data. Data informs. Now, it is approximated that we have over 3.8 million community health workers globally. And this is just from the 98 countries only. Dandelion Africa works with 2,500 community health promoters, of whom 78% are women. We know so much about unpaid care work. But at Dandelion, we train them on electronic communication health information systems, where they visit households, assessing their risk status and access to health facilities, in addition to being the first line of response. This data being collected is shared to our government, and we know that the government shares this data with you. The aim is that they can invest, and you can invest, in cost-effective solutions, for example, family planning, health education, reducing maternal mortality, reducing neonatal mortality, because without data, you cannot make informed decisions about how to mitigate climate change and how to stop the deaths of women and children. Because whatever happens in my village, in Risa, has a ripple effect to what happens to all of us. It is time for us to think about building, but not building back better, it is time for us to think about building sustainably. Why should you invest in grassroots organization? We identify and focus on systemic forces at the root of our community problems. We are deeply embedded in our communities and we are locally led. This provides local solutions without compromising on the dignity of our communities. For sustainability, we are here. We build permanent structures. We have solutions to our own problems. Now, to strengthen health systems, Dandelion intends to train 200 government health centers on emergency obstetric neonatal care, because we know that even when Dandelion is not here today, that skill will always remain and more women can be saved. We want to train 500 healthcare workers on administering long-acting and short-term contraceptives, because there is nothing more important to women than autonomy over our own bodies. To strengthen our community health, we want to train 3,000 community health promoters on climate mitigation adaptation strategies to support our communities, because they're the first responders. When we do all this, we will be able to reach 20,000 women with skills and knowledge, improving their economy. And you know what they say, when you empower one woman, you empower a full society. So what's our target? We are hoping to reach 1 million women with contraceptives over 3 years. The ripple effect is that 7 million women will be reached around the same time. You can be part of this story by investing in grassroots organization to mitigate climate crisis and ensure that no woman dies while giving life. Thank you for listening to me.